7:25 this morning. Thanks so much for staying with us on the AM report. We're going to continue our discussion now with Professor Glenda Gray. She is Johnson & Johnson's principal investigator, vaccine principal investigator. She's also the president of the SA Medical Research Council as we continue to unpack the various issues related to our vaccine rollout plan. Professor Gray, thanks so much for staying with us here on the channel. If you don't mind, I want to pick up on one of the points we were discussing, battling with that video line a little earlier, the issue of reaching that target of 1.1 million people receiving the vaccine by the end of March, given that to date we've got 55 million vaccines that have been administered to healthcare workers.
55,000.
55,000, sorry.
Well, I think so. That is an incredible record, 55,000 healthcare workers getting these vaccines from research sites and vaccination sites. So the rollout has been successful to date. And I think that there's a tremendous achievement. And so I think what we should be doing is celebrating the fact that we were able to use up the first tranche of the 80,000 vaccines even before they were due to be used up. So we were going to vaccinate 80,000 healthcare workers over 14 days. And we've achieved this by the weekend. And that means that we have to keep on moving vaccines into South Africa. Every day we lose our ability to reach our targets. Yeah. And so it's critical that we act with speed to get the vaccines into our country.
So we've got 500,000 of the Johnson & Johnson vaccine, I understand, on order, 600,000 of the Pfizer vaccine on order as well. Government now getting some criticism, and I wonder if you can weigh in on this issue, getting some criticism by those in the private sector that government is monopolizing the vaccine rollout plan. How do you respond to that? How do you read that?
Well, I think it's critical that we all understand how the vaccine program should roll out. And once you've perfected it, it's important to bring in as many partners as possible. And I think the support of big business, of workplace practices, collaborating with the government to make sure that this all happens properly. We also have to be careful about contraband or illegal vaccines coming in, and also coming in at excessive prices, which cause huge problems. Vaccines are a scarce commodity. They get stolen, they get reused, and people sometimes take used vials and fill them with water and fill them on as real vaccines. So we have to make sure that vaccine use and transport and purchase is well controlled. Otherwise, we could be leading ourselves into a lot of trouble in terms of making sure we know that we're giving the right vaccine to the right people at the right cost, and that the data that we have the right data for the vaccines that are coming into the country.
Right. So speaking on matters on the continent, Ghana becoming the first country in Africa to receive its vaccines from the COVAX facility. Can you give us an indication of when South Africa will receive its vaccines from COVAX?
Well, I think there are negotiations, and we're obviously looking to replace the AstraZeneca vaccine with a Pfizer. South Africa is one of the few countries in Africa that can support a -70 cold chain, and so it's appropriate that we use those available Pfizer vaccines in South Africa, because other countries in Africa may struggle to maintain the cold chain.
Professor Glenda Gray, thanks so much for your time this morning on the AM report. As always, she is Johnson & Johnson Vaccines principal investigator. She's also president of the SA Medical Research Council as we continue to track South Africa's vaccine rollout plan.